Chris Hensley is a registered representative of Cambridge Investment Research, Inc., a broker-dealer member of FINRA SIPC. Investment advisor representative of Cambridge Investment Research Advisors, Inc., a registered investment advisor. Cambridge and Houston First Financial Group are not affiliated.
The Houston Midtown chapter of the Society for Financial Awareness presents Money Matters with your host, Christopher Hensley.
Good morning, everybody. You're listening to Money Matters on KPFT Houston. I'm Chris Hensley. The time is now 11 a.m. Got a great show lined up for you today. When it comes to healthcare, why must we commit to paying without knowing the price? Where else would consumers be expected to do that? In her book, The Healthcare Consumer's Manifesto, How to Get the Most for Your Money, Deb Gordon answers that question. So, spoiler alert, keep listening, stay tuned. We will do a deep dive into healthcare and what the consumer needs to know when it comes to doing the right thing with healthcare. So please stay tuned, keep listening. If you are a long-time listener, you do know we always reserve just the first few minutes of the show to tell you a little bit about what's going on in the Houston and the Gulf Coast area when it comes to financial literacy. So we are in right at the tail end of February. Last few days of the month, we are about to enter into March, and then it will be April. You've heard me talk about Houston Money Week for months leading up to the event. The events, I should say. Houston Money Week is a nonprofit initiative with not just nonprofits, but for-profits, banks, schools, city government. We've got the high schools, the universities, and the one thing that they all have in common when they get behind this is that we do financial literacy and educational events for Houstonians, and I can even say outside of Houston for Gulf Coast region, up in Huntsville, in Galveston. This has really grown over the last 10 to 11 years here. And so we're getting closer and closer to that event. In fact, I can point you to the website, which is HoustonMoneyWeek.org, and we have a dynamic calendar that has all of the events that are being hosted by partners of Houston Money Week. They are all free, open to the public, and the one thing that they do have in common is that they all have something to do about finance. Now, they're all going to be different. There might be some on tax preparation. I know our VITA nonprofit partners, they do free tax preparation for low to moderate income. They might be on retirement planning. They might be on budgeting. And so it's really, really one of those things that you can go to the website, punch in either the zip code so you can find something that's close to you by geographical region, or if you're interested in a certain topic, then you can look in there and dial up what topic you would like to go to. Now, if you want to be part of Houston Money Week, you can participate by having somebody come out to your employer, to your church, your synagogue, your even a civic organization or professional organization that you're a part of. If you wanted to have somebody come out and host an event, that's something that you can do to participate, or you're always welcome to come out to our partner meetings that are held at the United Way each and every month, and you can find out more information on that by going to HoustonMoneyWeek.org. With that, let's go ahead and get Deb on the line so we can maximize the amount of time that we have with her here. Deb, are you there?
I'm here.
Absolutely. Well, thank you for joining us today.
Chris, thanks so much for having me. It's a pleasure to be here.
Absolutely. So I always start the show kind of the same way. I'll share your bio with listeners so that they can get to know you a little bit better here. Now, you've spent your career trying to level the healthcare playing field for consumers and now advise on startups and innovators trying to make healthcare better for everyone. You're a seasoned executive specializing in healthcare innovation, strategy, marketing, communications, and growth. Once again, thank you for joining the show.
Thanks so much. I appreciate it.
Well, Deb, let's start with the book. The book is called The Healthcare Consumer's Manifesto, How to Get the Most for Your Money. Tell us why you wrote this book.
Sure, absolutely. I felt really compelled to write this book because I have spent my career, as you said, working in healthcare, and what I started to notice was almost desperation amongst consumers of all walks of life. Didn't matter how much money they had or how educated they had. Everyone is confused, overwhelmed, kind of freaked out sometimes about their healthcare decisions. So I wrote this book to really expose the human side of healthcare costs and to help consumers reclaim economic power in healthcare. If I may, Americans now pay 1/3 of all healthcare expenses in the U.S. out of pocket. That's $1 trillion a year. And we're paying more and more as individuals. And, I think we're not really equipped or prepared. The system doesn't really help us navigate. And I felt like I could play a role to help folks.
Absolutely. And this is not, this is stuff that's being hotly debated right now, especially with the election year coming up. Can you frame some of that for us? Why is this such a hotly debated issue in the country right now?
Yeah, healthcare is a huge, political issue, but it's really, and how I approach it, it's really a financial issue, which is, I think, why we're here in this conversation, right? And when you talk about finances, you get a lot of stakeholders. A lot of people care a lot about it. And the whole industry is living on the status quo. But then, what's happening is more and more of the costs are shifting onto individuals. And I think most of your listeners probably have some personal experience with this. So if you've opened your mail and gotten a healthcare bill, or if your employer, used to pay 100% of your healthcare, your health insurance, and now pays 80 or less %, you know what I'm talking about. And that's what makes healthcare so important, so hot, so controversial, if you will, because we all are going to get sick or need a checkup or need some kind of health care at some point. It literally affects all of us, and it transcends politics and your political persuasion and all of that. But it's a huge industry, and it's very complicated. So there's a lot of angst and feelings about it. That's, I think, why it's so front and center. I'm happy to, talk more without getting too political.
Oh, but yeah, for sure. I know for a lot of my listeners, as a consumer, I know, we just had to go pay out of pocket for my son's prescriptions the other day. It was like $200 for just two prescriptions. But I know a lot of my retirees who are having prescriptions, and this is one of the things that they have to solve. As you were researching this book, what were some of the most surprising findings that you found?
Yeah, I really believe that when we spend healthcare dollars, we're spending our own money. Actually, we are spending our own money. More and more, that's true. And I was so surprised that people I spoke to didn't really think of healthcare expenses as their own money. They thought, I've got insurance, so it's free. It's like, I don't know whose insurance covers anything for free anymore. Even seniors, as you said, they're always paying something, and those costs are going up and up. So my first real surprise was how foreign the idea of sort of shopping. I would ask people, can you just give me an example? I started off every interview. Tell me about a time when you made a healthcare purchase. And I would say every other person, if not more, did not even understand what I was asking. And then I would say, when you've spent money, your own money on your healthcare or your health insurance. And then people might have an example, but even still, some people were really confused by that. So this idea of, we shop for everything. Americans, anyway, we shop. We're we're masterful shoppers, right? But when it comes to our healthcare, we don't think about our financial relationship with healthcare in the same way at all. There are a lot of good reasons for that, but I kind of think we should shift that mindset a bit. What I also was surprised by or really intrigued by is when people did think of it that way. So I interviewed people who, I would ask everyone, did you ever negotiate the price of healthcare or, the cost of a healthcare service or something? Most people had no idea, had no answer for that. They would say, oh, is that possible? And I would say, oh, I'm just asking, have you ever done it, not telling you to go do it. But occasionally people had these amazing stories of, real negotiating or self-advocacy where they were able to save a lot of money. And I think that was really inspiring to me. It helped me think about, consumers do need to think about healthcare differently. And I, in the book, I try to go deeper into how to think about it so that you can get the most value for your spending.
Oh, yeah. I think that would be a total shift in a mindset there. You said that most people, when you ask them that question, they were like, is that even a thing? Can we do that?
Exactly. They literally said that. Is that a thing? And I don't know. What do you think? Yeah.
One of the things that you talk about is empowering the consumer power. What do you mean by that? Yeah,
I really want us as a nation, and a lot of people don't like this idea. It makes doctors uncomfortable. I'm married to one. I can say this for sure. But I really want Americans to start thinking about healthcare as something we can shop for. Because when we're shopping, we're in a store, we're online, we're at a restaurant or a cafe, we know that we are the customer, and we should be nice and polite and respectful and reasonable about it, but still on some level, we understand that we're paying for a good or service, and we deserve something in return. We deserve to know what we're buying. It should work as advertised. It should deliver value. It should deliver on its promise. But in healthcare, we kind of put up our hands. We don't question. Myself, I once went to an acupuncturist who prescribed me some herbs. And I was like, okay. And I took them and I brought them home and, I paid for them. And my husband at home said, oh, what are they supposed to do? And I said, oh my gosh, I have no idea. I didn't ask a single question. I just took them blindly. And I'm a consumer advocate. So I think that passivity in healthcare is not our friend. We are entitled to ask questions, to know what we're buying, to know where our money goes, to know if we have alternatives, and to stand up for ourselves if something doesn't go right or doesn't feel right. And that's what I mean by empowerment. I really just want, an empowered mindset. An empowered consumer is someone who feels sure of themselves and entitled in a good way to understand and get what they need.
Before we talk about the actual consumer manifesto portion of the book, in the consumer power, and we're going to give people link. You can find out more. Deb, your website it's debgordon.com. Is that correct?
Correct. Yes.
And we'll definitely have that on the podcast notes as well. But one of the things you talk about is psychotherapy and how that functions and the free market and what we can learn from that. How does that play into this?
Yeah, if you have children, you're not supposed to love one more than another. But I loved writing that chapter. I absolutely loved it. What I did was I observed something when I would talk to people for this research. Consumers would say, they'd tell me these horrible stories about getting a surprise medical bill or being really frustrated. They had a surgery, they went into debt, or, whatever was the situation in their medical care. And it was like terrible and messy and frustrating. And then they'd say, oh, by the way, I also go to a therapist and I pay out of pocket for that. And I would say, oh, do you get bills? Are you surprised by, do you tell me about the messy stuff, I guess. I didn't ask it that way, but I was curious, oh, how does that all work? And what I was just amazed. People said, of course not. I never get a bill. I never have a surprise. We talk about the cost up front. I decide if the service is worth it to me and if I can afford it. If something changes in my financial situation, I approach that with my therapist and we have an open, honest, healthy conversation about it. And sometimes that therapist will work with me if I have a challenge. And so I thought that's really, really different from the rest of medicine. I wonder how do they do that? And I went around and I interviewed about a dozen psychologists and psychiatrists or other therapists in private practice. And I said, I really felt like I only needed to interview one. After the first one, they said the same thing, which was, of course we talk about cost. Of course we have to, make sure that our patients know what we charge and that it works for them. Therapy shouldn't be a hardship, but I also have to earn a living. And so there was this whole openness about the financial aspects of psychotherapy. Now, there's a lot of challenges in mental health care, and I don't want to gloss over those or minimize those. A lot of people who need care have trouble accessing it, and that's a real problem. But just if we can indulge me, let's look at what we can learn from that market. It's a free market, and good and bad, the consumer, the patient really is in the driver's seat, knows what the costs are, can decide for themselves if the costs are worth what they're getting. That's it. There's no giant billing department or accumulation of debt or financial strain that goes unaddressed. If there's financial strain, you talk about it. And I think the rest of medicine really could take a few pages from that market example.
Oh, absolutely. That's completely juxtaposed to, hey, how much is this going to cost? And I don't even know where to begin.
Right.
And so that's a different kind of mindset there. And that kind of transitions us into the second part of book, The Consumer Manifesto, where you start with how much will this cost? What do we need to know about that?
Yeah, I mean, this is the most fundamental problem for consumers in healthcare. We just don't know what things cost. And the answer has been for a long time, in the healthcare industry, well, we need to, address price transparency. We need to publish prices. My argument, and in that chapter, I go deeper into why are prices so hard to publish. And the real answer is they're very convoluted. They're not related. It's not particularly related to cost. So the hospital who charges, I'm making up numbers, but, $30,000 for a procedure, it's not necessarily directly linked to how much it costs to provide that procedure. Not everyone has clarity or transparency into the cost. Therefore, it's really hard to publish a price. The other thing I advocate in that part of the book is to start to not only ask, just asking what it will cost is a big first step, but I would encourage people to start asking why. That's a much harder question to answer, and it will make people uncomfortable. So not everyone's like me, willing or eager to suggest we make a little trouble. But I think if the healthcare industry has to answer why does it cost so much, I think that will bring about a little bit of self-reflection and potentially put a little pressure to rationalize some of those crazy bills we've all heard about.
Absolutely. So the first thing you said is to ask, how much is it going to cost? And the second thing is to ask why, and I'm sure that does make them uncomfortable. I know when I picked up my prescriptions last week, my jaw dropped. It's like, really? Right. That's how much it costs? And then you also mentioned that these prices aren't necessarily tied into cost as well. What can we do? What can we do about this once we have the information of what it costs?
Yeah, especially in your example of the prescriptions, there's actually a lot of variation, and I would encourage people to shop around. Now, it's hard to even, again, in healthcare, we don't feel like we're shopping, so we don't remember sometimes that we might have options. I would always ask, before you even leave the doctor's office or go to fill a prescription, you can ask them, are there alternatives? How much will it cost? If you can stomach asking why, if it sounds crazy, I encourage you to ask why. But let's just say you find out what it's going to cost you and it sounds a bit high. You ask the next question, which is, are there alternatives? Very often there are. And then once you know you've got the best, most appropriate prescription, you can look at different pharmacies might have different prices. So not everyone has, a different drugstore on every corner, depending on where you live. But there are online pharmacies now and different chains. If you are in a market with options, shop around. There can be a big price variation. I have a lot of stories about people just doing that and being amazed at the difference between, a $60 co-payment or cost and a $10 cost or whatever. I'm making up those numbers, but those are the right kind of scales. There can be a wide variation.
So I love that because I am one of those people that will go out on a limb. I'm not afraid to say, if the doctor's like, is cost an issue? Yeah, cost is always an issue.
Right.
I'll ask. And so I love that question. Are there alternatives? Because sometimes there are generic versions of almost the exact same thing. And then you mentioned even just the pharmacies having different pricing. That's a thing. It may be a little bit further to drive, but if it's cheaper, or if it's available in mass and scale and cheaper through there, knowing what those options are huge. In my own, you're usually at a point where you just heard a diagnosis. Oh, my son's sick, or I think if you've heard the show before, I talk a lot about the CPIE and the idea that the Social Security being tied into actual cost for the elderly, and those prescription drugs go right into that. And so a lot of times these are when we've just had a diagnosis, we don't necessarily feel like we could be negotiating or empowered as consumers. And so this is great information to have. One of the other things that you talk about is speaking our language and kind of the jargon that's there. Can you talk a little bit about that?
Yeah, and I worked in a health insurance company for almost 10 years, and I was in charge of all the communications we wrote and sent out to our members. And I know how hard it is to translate insurance jargon into plain English or Spanish, whatever is your prevalent language, but the point is plain language that anyone can understand. And I think that what happens is well-intentioned people become very expert in their field and start speaking to one another. And healthcare is very regulated, so there are a lot of rules and a lot of just requirements. And sometimes we would have to publish notices about insurance regulations that there was no way to really make it clear. And I think that does such a disservice to individuals because, we shouldn't have to, nobody goes to school to learn to become an insurance expert, and you certainly shouldn't have to be able to use your health insurance or to get what you need in the healthcare system. So I actually took a pause in the book and just defined a bunch of the terms that I understand are most confusing to people. The terms will change. And so we have to kind of stay on top of it. I think that the industry has a lot of work to do to really simplify and clarify the language we even use because it creates a real obstacle to getting value. That said, what I think people can do about it, I don't think it's fair to have to learn a whole new language, but there are a few key terms to master. And then I think it goes back to my first point, which is ask the questions. Ask until you feel you understand. It can be very hard to do that, especially in the context you described. You're sick, you've just gotten a diagnosis, you're overwhelmed, maybe you just want to get out of there. Whatever is the situation, it's not ideal for learning and absorbing new information. But I would certainly try to ask. The other idea that I would offer is bring someone along or ask, find someone who is maybe not right in the heat of that moment, and ask them for help. I think that's the key thing. We can't get what we need if we're not willing to, articulate what we need or admit when we're confused. There's no shame. Everyone is confused. I talk to doctors, I talk to professors, I talk to nurses, and they were confused. So if the insiders and the experts who basically run the system can't answer all these questions, then there is not only no shame in not knowing, like, how could you possibly know? So I guess what I'm trying to do in the book is really encourage people to just be open and honest, and to have, no shame in asking, no shame in not knowing. Nobody knows. So that's good and bad. Nobody really knows. That's terrifying. And on the one hand, right, but on the other hand, it means that there's not some secret knowledge. If you only had it, you could master it. No, it's like for all of us to crack it open, one question at a time.
I love it. I love it. So yeah, dive in there. I know finance is the same thing. There's jargon around it, and as you have to have your decoder ring to get through it, but it's worth getting through. You said ask those questions until you feel right about the answers there, and so that's huge. Deb, we've got just a few more minutes here before the end of the show. For people who are joining in right at the end, where can they get access to your book?
Yeah, they can order it anywhere they would order a book, the Healthcare Consumer's Manifesto. I also have a special sneak preview of a paperback version that's not available yet on Amazon, but it is available on my website, debgordon.com. And if just for your listeners, Chris, we made a promotional code. So if you plug in Money Matters Houston, you can get 20% off.
Oh, I love that. I'm always looking for a deal. So Money Matters, right? Houston. Good. I'm writing that down myself there. Well, so I'm moving into the very last part of the book, and we've only got a couple minutes here, and this is extremely interesting to me because I work a lot with seniors, and Medicare is complex and kind of crazy. A lot of people don't realize that it looks completely different than your traditional employer-sponsored health care plan. One of the things that you talk about at the beginning is dental care. What can you tell us about dental care in the next 2 minutes?
Oh, that's a whole show. Let's talk about it another day. No, just kidding. I mean, dental care, like mental health, has so many upsides and downsides. So downsides, it's very expensive. There is no real insurance coverage. Seniors in particular go without access to dental care. And it is a real problem. There is real inequity in dentistry. At the same time, if you can go to a dentist and can afford dental work or even just access a dentist, a lot of people can't even really reach one. What you find is the dentists themselves, they are business owners like everyone else. They know their costs, their prices. They'll talk to you about it. They know who's paying the bill. There's no real insurance. Dental insurance is not that generous. It's more like an offset than a real catastrophic coverage. And so what happens is the dentists know that you, the consumer, have to agree to pay the bill.
We are right here at the end of the show, but that is a great topic. I encourage people to go get the book.